always delighted to be able to support the sickle cell community because these students at most of our schools go unrepresented. There's little understanding about the needs and the accommodations that the students need in an educational setting. And if I can share any and all information that I'm able to gain from attending symposiums similar to today, as well as my own information from my nurses, I'm really excited to do so.
Hi, my name is Helen Mitchell. I'm a parent of a 25-year-old daughter that has sickle cell, SC. I have 25 years of experience as being a parent of a child with sickle cell. My child graduated from high school, graduated from college, graduated with her master's degree. She went away to college. I made sure that I didn't hinder her, and I let her do whatever she felt the need of doing. I want to share some of my experience as a parent of a child, a newborn child that has sickle cell. We did not have our first crisis until she was about 3 years old. And what helped us with the crisis in the middle of the night was massages, heating pads, hot ointments, and praying. We prayed, we prayed, we prayed. We did not use much medication because my daughter did not want to use a lot of medication. We did not, she was not hospitalized much because I was able to monitor her pain at home. And that's with, if her pain started off as a 5, I made sure I got on top of it right away with the pain medication, with plenty of fluid, with the heating pad, with the massages, and just thinking positive. What helped my daughter with her pain was a lot of distraction. So she enjoyed going to school even when she was in pain. In college, she had to have her gallbladder removed, and so I had to fly to New Orleans to get her and bring her back here so she can have surgery and she can recover at home instead of in a dorm. And I'm glad that I did that. And so she just missed 3 weeks of school, so it was great. I have always taught my daughter that she has sickle cell, but sickle cell does not have her. And so she has pressed on all her life to achieve everything that she wanted to achieve. She is driven, and I made sure that she stayed focused. She was part of Hurricane Katrina, so that was a little setback, but I relocated her and brought her back home for just 3 days, and then we got on a plane and we went to Fayetteville, Arkansas, where they accepted all the Katrina people, and she went to University of Arkansas. That was rough for us because being in Fayetteville, Arkansas, she had several crises because she was under a lot of stress, of course, and she was out there with no one that she knew. And the ED department was not the best, so it was rough for us. But I thank God for Dr. Keith that I was always able to call him, and he was always able to intervene and help us out. My advice for parents with children with sickle cell is to make sure you educate them about their illness. Let them be proactive. You want to be their advocate. That's very important because I have always been her advocate, always will be her advocate, and I will be other people, children advocate also. I've been a volunteer for Children's Hospital for over 20 years, and sickle cell is dear and near to my heart. We have a long ways to go, but we have came so far with sickle cell. continue. I can't say enough about continuing to educate your children and educate yourself and people that is around your children. The transition workshop is awesome, and I just wish every parent would take advantage of the transition workshop when it's your time. You learn so much. Do not be afraid to ask questions. Do not be afraid to ask for help, because help is there. I'm part of the advisory board. We are here for all parents and children that need us pertaining to sickle cell. I'm constantly trying to educate myself and learn more and to be there for others, because it's so important, because I know what support means, and everyone needs support, especially with a chronic illness. A chronic illness is something that I never thought that I was going to have to experience, but here I am. I don't regret it. I don't say, why me? I know God gave us this for a reason, and that is what my daughter says all the time, and we're okay with it. Educate, educate, educate. Support, support, support is very important. Make sure your children go to all their doctor's appointments. Make sure you ask all the questions. Before you get to the doctor, write your questions down so you'll know which questions to ask, because we know that as we get there, we forget. But make sure your children speak for themselves, because they need to know. Because when my daughter went away and she moved to a different state, she knew about her illness. She knew about which medication she was taking and what she was taking them for. A lot of the doctors didn't like that because of their ego, but she knew. So just educate them, educate yourself. That is just so important. Get involved. The support group I didn't have it when my daughter was coming up, and I wish I did, because I felt alone. Even though I had a big support system, but I felt alone because none of my peers had a child with a chronic illness. So I was alone. So get into a support system where someone can be there with you. Someone knows the shoes you're walking in. And that's why I guess I'm an advocate, and I'm very involved in the support group, because I've walked those shoes. I've been walking them for 25 years. It haven't been easy, but with the grace of God, I've made it through. And with the support system that I've had with the sickle cell community, I made it through. So just do your part. Don't expect for anyone to give you the information or just throw it in your lap, because it's not going to happen that way. You have to seek it out. You have to do what you need to do, and then you have to be active and proactive and show your children that you're proactive, so they will follow suit.
My name's Deborah Taylor, and I spoke on the transition workshop today, parents transitioning their young people into adulthood. So what's most important for me as a parent when I speak about transitioning is to take the holistic approach, and not just to transition our young people with regards to their health condition, but every aspect of life. To guide them, walk with them along each one of those milestones that they experience, teaching and training along the way, so when they become young adults, when we step back and allow them to move forward, they're able to stand on their own.
I'm Dr. Craig Adams, a licensed psychologist, and I was the keynote speaker for today's conference. One thing that I hope that everybody takes from the conference today, from my perspective, is that change is okay, transition is okay, but make the determination that when you're shifting to the next level, you will accomplish it. Not that you can, but you will accomplish it. Determination is going to determine whether or not you succeed, not just the fact that you have it in you.
Hi, my name is Valerie. I'm a social worker with the Pediatric Sickle Cell Program as part of the Comprehensive Sickle Cell Center here at Children's Hospital in Oakland.
And hello, my name is Kimberly Major. I'm also a medical social worker at the Comprehensive Sickle Cell Program at Children's Hospital Oakland. And today was our successful transition workshop. Today we'd just like to give you all some brief techniques and tips on how to successfully move from pediatric sickle cell healthcare to adult sickle cell healthcare. So be prepared. P stands for plan to take the time to learn about your sickle cell.
R stands for ready yourself for change.
E is for expectations and settings will change.
P is for practice building self-care skills, communication skills, self-advocacy skills, which are needed for independence.
And A, ask your healthcare providers for help.
R, realize the importance of knowing about your health in order to reach your full potential.
E, experience will help reach your independence.
Hi, my name is Theopia Jackson and I'm a clinical psychologist at Children's Hospital Oakland in the Department of Psychiatry. And I've had the pleasure of working with many families and patients living with sickle cell disease. And the messages I'd like to give to patients first and foremost is that sickle cell disease is only one special part of who you are. There's so much more to you. And learning to live with your sickle cell disease is a blessing for you and it's a courageous act that you can do if you have the right team to work with. Make sure your team works for you. That's your healthcare providers, your doctors, your family, your parents, your brothers, your sisters. It's your friends. Choose a friend or two who you trust to know about who you are, to know about your sickle cell disease and what he or she can do to help you when you have a pain episode. I also want you to know that your spiritual leaders are part of your team and your educators at school. But be very clear who you want on your team and how they can work for you. Ask questions, learn about your disease, learn how it affects you and what works for you. Lastly, please know that if and when you do experience pain, there's lots of different reasons for feeling pain. All of it's not sickle cell disease. Sometimes we're really stressed. Sometimes our bodies are very tired. Sometimes there's real hard things going on in our life that shouldn't be happening. And that can help to lead to pain as well. So then it may be helpful to talk to someone like me, a mental health provider. Someone can help you understand the different reasons for why you might be experiencing pain and what you can do and others can do to help you with it. My best recommendation to the parents around transition is that you're going to help your child be ready to transition the day he or she is born. It's a lifetime event. It doesn't happen overnight. So prepare them like you would anything else in their life to be ready to handle on their own. You are their best advocate. You know their pain and their sickle cell disease better than anyone else, but you must turn that knowledge over to them so they will know how to use it for themselves.